We now talk to infectious diseases specialist, Dr. Edsel Salvaña. Good morning, doctor. Thanks for taking our call.
Good morning, Ria. Good morning to everyone who's watching and listening.
Doctor, could you give us the reason for this slowing down of cases in NCR, but this increase in the provinces, especially in the Visayas and Mindanao?
Right. Whenever you do something drastic, like when we did ECQ and MECQ, you decrease the number of people on the street. So you decrease mobility, and naturally the number of cases will go down. Usually there's about a 2 to 4 week delay, and we did see that. The problem is every time you close down, it's bad for the economy. People aren't able to work. There's a lot of hunger that happens. And so, we've learned in the past, these big-time lockdowns do slow down the spread of disease, but they're not a long-term solution. This is like what we call the hammer. When the hospitals are overwhelmed, we really need to give them a breather. But we really want to minimize the times that we do this because, again, it's really bad for the economy. So we need to learn to live with the virus and only do these lockdowns as a last resort when our healthcare capacity is overwhelmed. And that's why there has to be two things. First is that we need to be able to keep transmission low even when people are moving about. And second is that we have to build up our healthcare capacity so that we're able to take in, even as we open up, if there is an increase in the number of cases, the healthcare system won't be overwhelmed.
Okay, regarding the Visayas and Mindanao, doctor, we're seeing an uptick there. To what can we attribute this?
Yeah, I think that the variants are starting to get outside of Metro Manila, and this is borne out by sequencing data from the provinces. And as we know, these variants are more contagious. And the other thing is really just pandemic fatigue. I think everyone is sick and tired of this pandemic. And the problem is that the virus never gets tired. So, we just got to keep at it. We're seeing countries where vaccination rates are high, seeing a decline in their cases. And the most dramatic is that even countries that still have high rates of cases but have vaccinated a lot are really dropping their deaths because we know that the vaccines protect against severe disease. And so we just got to keep vaccinating and keep the cases down as much as possible. We just have to be patient. The vaccines are the solution, but we need to get there first before we open up drastically.
Right, you mentioned it seems that the variants are moving outside NCR and moving to other parts of the country. But we're learning now about a new variant discovered by Vietnam officials. And it seems to be this hybrid of variants that are found in India and the UK. Can you tell us more about this? What do we know?
Yeah, the reports are very sketchy. We haven't even seen the sequences yet. We know that mutations, similar to what have been seen with the variant from UK and the variant from India, do emerge de novo, meaning in viruses that are not necessarily related to those variants spontaneously, because the virus mutates. And there are mutations that what we call are a product of convergent evolution, meaning that given enough time, enough cases, enough chances to mutate, the virus will go towards that mutation anyway. And we did see this with the variant from the Philippines, P3, where E484K, which is found in the variant from South Africa, and N501Y, which is found in the variant from the UK, emerged independently. And there's no evidence that it's any kind of hybrid. So these mutations do come out. And we need to study very well whether this really is a hybrid or if it's really just another variant that acquired these mutations in the course of natural mutation. And that does not necessarily translate to increased transmissibility or decreased susceptibility to our vaccines. Because, for instance, P3, which is our own variant that was discovered in the Philippines, doesn't seem to be a variant of concern now because the number of cases has not really skyrocketed. We still see 1 or 3 from time to time. But it doesn't mean that because there are mutations of concern in a variant, that it automatically makes that a variant of concern, because there are a lot of other factors that can affect transmissibility, as well as whether it's more deadly or less susceptible to our vaccines.
Right. So for this Vietnam variant, we don't know yet if it's a variant of concern. Is that what you're saying?
That's correct. We don't even know what it looks like. They're just saying, from what I've read so far, is it has a Y144 deletion, which was also found in the variant from India. But I don't know if it has N501Y. I don't know if it has E484K or L452R, which is the signature mutation of the variant from India. So it is very preliminary, and I really do wish that people would be more careful when they share this kind of information, because it really gets sensationalized and causes a lot of needless panic. The truth is, the variant from UK, the variant from India, the variant from South Africa, these are all very concerning variants, and we really, really need to already double down on our public health measures, because they are more transmissible than the previous viruses, and so I don't think we need to make up stories to tell people that this is getting worse. Doing sensationalizing news like this is really counterproductive, because it just makes people panic, and it doesn't really have a good basis in science yet.
Right. And no matter what the variant is, the minimum health protocols are still pretty much the same anyway. Is that right?
That is correct. But what it also means is that we do have to prepare better, because if there is one or two people who don't follow the protocols, then instead of just a surge in the tens, it could be a surge in the hundreds. And we know that viruses, particularly SARS-CoV-2, which causes COVID-19, can really cause big surges. And it would be very, very difficult to control once there is exponential growth.
That's right. Thank you so much for your expertise. Always appreciated. Infectious diseases specialist, Dr. Edsel Salvaña.